All right, let's dive right in. Today we're going to break down the science behind a technology called rTMS and what it could mean for managing some of the toughest symptoms in cancer care. So what does the latest evidence really say about its potential? Let's find out. So here's our game plan. We'll start with the why, the huge unmet need that exists in cancer care. Then we'll get into the what, this rTMS technology. From there, we'll dig into the key findings on safety and, of course, effectiveness. We'll also do a crucial reality check on the limitations of the current research, and finally, we'll look at the road ahead.
Okay, first up, the unmet need in cancer care. Let's really understand the silent burden of survivorship, because this is the reason why new treatments are so desperately needed.
Think about this number for a second, 53.5 million. That's how many people around the world are living 5 years or more after a cancer diagnosis. And while that is, of course, a huge victory for modern medicine, it's not the whole story. For many, surviving cancer is just the beginning of a whole new set of challenges.
So what does that burden of survivorship actually look like? Well, the numbers are pretty sobering. We're talking about a staggering 80% of patients dealing with debilitating fatigue. Nearly half are living with persistent pain. And on top of that, you have more than a quarter struggling with anxiety or depression. These aren't just minor side effects. They are profound barriers to living a full life.
And here is the absolute crucial point. We know these symptoms are incredibly common, right? But look at this. Less than 35% of patients with pain actually get treatment for it. For fatigue, it's even worse, just 20%. That is a massive treatment gap, and it's exactly why researchers are searching for new, innovative solutions.
That treatment gap leads us right into our next section, rTMS, or Repetitive Transcranial Magnetic Stimulation. Let's take a look at how the scientific community is investigating this potential solution. So what exactly is rTMS? Well, the key thing to know is that it's non-invasive. Think of it like this. It uses focused magnetic pulses from a device placed on the outside of the head to gently and precisely modulate the activity of neural circuits in the brain, the very circuits that are involved in mood, pain, and fatigue. No surgery, just targeted magnetic energy.
Now, it's important to know where this information is coming from. Everything we're discussing is based on a comprehensive scoping review. Researchers essentially gathered up all the available studies on this topic, 17 of them covering a total of 406 patients. And these patients were diverse, with different cancer types, stages, and treatment histories, giving us a good bird's-eye view of the research landscape.
Okay, this brings us to the big questions. What did the review actually find? Let's get into the key findings on safety and efficacy. And in any medical research, you always start with safety.
And the answer on safety is pretty compelling. Across all the studies that looked at it, the review found no serious adverse events that were directly caused by the rTMS treatment itself. Now, there was one notable incident of a postoperative seizure, but it's important to note this was in a patient who had just undergone brain surgery. So while it highlights a need for caution in very specific high-risk cases, the overall safety profile looks very strong.
So if serious events are off the table, what about smaller side effects? Well, the good news is that when they did happen, they were consistently minor and short-lived. We're talking about things like mild scalp discomfort or a brief headache, which usually went away before the patient even left the lab. In fact, patients tolerated the treatment extremely well, had high completion rates, and gave very positive feedback.
Okay, so it appears to be safe. That's a huge first step. But now for the million-dollar question. Does it actually work? Let's break down the evidence for efficacy across the different symptoms.
And this is where things get really interesting. The most solid, most robust finding was for pain relief. Every single one of the 6 studies that looked at pain reported significant improvements. Some even saw patients reducing their use of opioid medications, which is huge. Then there's motor function recovery, especially after brain tumor surgery. One study showed patients recovering in just 12 days, compared to almost 30 for the control group. That's a massive difference. We also see multiple positive studies for reducing depression and anxiety, and even for that very difficult-to-treat nerve pain caused by chemo. A clear pattern of potential benefit is definitely emerging.
Now, those findings are incredibly promising, but this is science, and a rigorous approach demands that we do a reality check. It's absolutely crucial to understand the limitations of the evidence we have so far.
One of the biggest challenges is what scientists call heterogeneity. Basically, it means almost every study did things a little bit differently. The treatment duration, the intensity, the frequency, even the exact part of the brain being targeted. It was all over the map. This makes it really hard to compare results and figure out what the single best, most optimal treatment protocol might be.
Beyond the different protocols, there are other weaknesses. Many of these studies had very small numbers of participants. There was a lack of diversity, with patients being predominantly female. And a big one, most studies didn't follow patients long-term, so we don't really know how long the benefits might last. Now, this is all pretty normal for a new field of research, but it does mean we have to be cautious about generalizing these findings too broadly, at least for now.
Okay, so we've seen the promise, and we've seen the areas that need improvement. Let's put it all together and talk about the conclusion and the path forward.
So what's the bottom line? I think the best way to describe it is with cautious optimism. The body of evidence we have so far strongly suggests that rTMS is a safe and feasible option for patients, and it's potentially very effective for managing a whole range of these debilitating symptoms. To get from potential to proven, the review gives the scientific community a very clear to-do list. First, we need bigger, more powerful, and well-controlled trials. Second, researchers need to work on standardizing the treatment protocols. Third, future studies must include more diverse groups of patients. And finally, they need to include long-term follow-up to see just how durable these positive effects really are.
And that really brings us to our take-home message. rTMS shows clear safety and undeniable potential in cancer care. But, and this is a big but, the road from a promising research finding to something a doctor can actually prescribe is a long one, and it's paved with exactly this kind of rigorous scientific validation. The potential is there, and now the scientific community has a clear roadmap to prove it.